Hello, future doctors. I'm Dr. Shivangi Shukla, and today I'll be talking about a very important topic. This is a topic that most of us dwell upon, but mostly at a very later stage when the window for corrective action has already elapsed, and all we are left with is repentance. Yes, I'm talking about mistakes, very commonly made mistakes during the first year of MBBS. Today, I'll be speaking about the three biggest mistakes that most people make during the first year of MBBS and how to avoid them. So, let's begin. The first and the most common, almost ubiquitous mistake is the inertia post the NEET PG exams or the NEET UG exams. Consider this scenario. You have been a very bright student, a meritorious student, a very diligent student throughout your life. And after a lot of hard work, the whole year or a couple of years of hard work, you have finally managed to crack the NEET exam. Congratulations! You've been considered a hero of sorts from all over, from your friends, your family, and even the furthest of acquaintances are now calling you up, asking for tips and what. So now you're on cloud nine, and rightly so. You deserve this happiness. You deserve these congratulatory messages. But what follows is this feeling of complacency. You start feeling complacent that you have already achieved so much and now you need to relax. You need to take a break. I have been through it. I have personally experienced it, and therefore I can tell you that this feeling sinks in for almost all people, all the recently graduated students who have just passed their school and entered the medical college. Now, what happens is they start feeling like taking a break, going on trips, hanging out with friends, meeting new people, partying, enjoying, and whatnot. Everything apart from studies. They feel like because they've entered college, now they need to relax, they need to make merry, they need to just have fun. Do everything apart from studying. Okay, you deserve to take a break, but that break should not span the entire first year. So that the moment you start opening your books, you realize you haven't opened them. They're almost covered with cobwebs, and your university exams are just round the corner. Trust me, it gives you chills. A chill would run down your spine when you would know you don't know anything and you have those university exams just a couple of days later, and you see your entire batch, toppers in your batch, they are revising the syllabus maybe for the second or the third time, and you don't know anything about the syllabus at all. That feeling really breaks you. That feeling bogs you down mentally. So, because I have been through it, I have been in that place, so I can tell you that it is extremely difficult to cram things at the last moment in MBBS. Please, if you have been a student like me who could manage burn the midnight oil all throughout the school, who did not require a lot of studying for the entire year, and who could manage just studying at the last moment, trust me, this is not the gameplay that you can follow in MBBS because it is totally a different ball game altogether. In MBBS, you need to be consistent. Consistency and perseverance is key in MBBS. The first year of MBBS, which is the foundation stone or the bedrock, as I already talked during the orientation session, is the most important year for you as a future doctor. You need to make sure that your fundae are clear, that your fundae are rock solid in the first year. So you take a break, enjoy, but keep the break balanced. Keep the scales of entertainment, having fun, making merry, balanced with the scale of studying. Okay, so if you remember the monthly roadmap that I had made, I make sure that we do not end up just studying or just working hard. Rather, we take out time for play, that is, for enjoying, for entertainment, for leisure activities, for extracurricular activities as well, because that is also important for your holistic development. Okay, so this is one thing that you need to take care of, and this is a ubiquitous mistake that you should ensure that you don't make now. The second one, this is also becoming extremely common or rather trendy these days because students have started bunking or skipping practical classes and clinics. And how? They think that reading the MCQ books or the practice papers and past papers are going to get them sailing through the university exams and make them ready for the NEET PG exams. But they forget that in the bargain, they are missing out on the MBBS curriculum, which is what is designed to make you a good doctor or a good clinician in the first place. So a doctor is not a walking, talking textbook. No, a doctor is a holistic healer. Doctor is there to treat the patient. A patient will come to you to get treated and not to quiz you on your theoretical knowledge. He would not bother knowing how much you know if at all you are adept at treating him or diagnosing his disease. Therefore, you need to be extremely efficient and adept with your clinical medicine. You need to be extremely efficient in your practicals. Do not skip your dissection hall postings. Do not skip your physiology practicals. Do not skip your biochemistry practicals. Do not skip getting that one prick during the physiology practicals in your hematology slides. Do not skip testing the urine analysis, okay? Even if you get the feeling of you or yuck. No, that is extremely important. Okay, so just relying on theoretical knowledge and MCQs is not going to make you a good clinician, and it is not going to help you through your MBBS career. Okay, also the feeling that clinical postings are only important in the final year is also a very big myth, because clinical postings right from the first year are going to only reinforce your theoretical knowledge. Okay, so do not make this mistake. The third mistake is kind of a controversial one. Some of you would not agree to a few points that I would mention, but you can take it with a pinch of salt. So, resource management is extremely important in any stream, not just in MBBS. There can be no two ways about it. Now, what I feel is you cannot make multiple foundation books or multiple base books as your primary resource for each subject. That is a very big blunder, because that is only going to make things chaotic. It is only going to meddle up everything inside your brain. You must have heard of the saying, too many cooks spoil the broth. So I have tweaked it a little, saying too many books spoil the subject. Yeah. So you need to know that one resource or one base book per subject is the key. It should be the norm. And whatever additional knowledge you are acquiring from maybe the web, or from your seniors, from your teachers, or reading articles or textbooks or other books, you should add it as notes, jot them down in your resource book, in your primary book as notes, so that whenever you go through that chapter again, you know that this is the additional information that is an add-on, and it gets reinforced time and again. Now consider this scenario. You're reading from one book, then you read the same chapter from the other book, or suppose another chapter from another book, and in this way you have read different chapters from 4 or 5 different books. How do you plan to revise this entire syllabus one day before the exam? Because a lot of topics need to be revised just one day before the exam, both for your university exams as well as for your PG entrances. So you need to have consolidated knowledge. You need to have a consolidated resource for each subject. The next thing is, which is extremely important, is note making. Do not read from others' notes, from notes made by other people, because note making is a skill which is individualized. It should be personalized and customized. You make notes for things that you want to remember, that you want to recall or keep in your memory, because you may be forgetting it, or you think that it is extremely important. Now, something that is important for you might not be that important for another person, or something that you are forgetting or you think needs to be reminded again and again might not be so for another person. So if someone has made a note keeping in mind his or her shortcomings, that cannot be copy pasted for you. You need to make your own notes. The third and extremely important point is, which is extremely bothersome to me sometimes, people tend to read from guidebooks or key books as primary sources. No, guys, you can refer to guidebooks because they have excellent flowcharts, diagrams sometimes. So you can refer to guidebooks, shortcut books, past papers for high yield topics, or for memorizing or ratification of some topics that you keep on forgetting or that you need to vomit during your exams. But you don't have to use them for building your base. You cannot use a guidebook for acquiring knowledge. You cannot use a guidebook to explain the concepts or to clear your fun day. That is going to happen only through your resource book or through your base book. Talking about myself, I've always considered Harper as my base book for biochemistry. You can use any other book or Harper's only if you feel like, or as you're getting advice from your seniors or from your professors. So till now, I consider Harper as my base book for biochemistry, and I keep on adding whatever new concepts or whatever new advancements, especially in molecular biology. We tend to get advancements every now and then. A lot of research is happening worldwide, so I just keep on jotting down small notes in individual chapters. So these are the 3 very common and very big, ginormous mistakes or so that I may say. And I hope after this session, you would avoid making these mistakes, these blunders. And I hope this has been of some use to you. Thank you.